Hello everybody, my name is Shrinidhi Kulkarni and I'm from KLE BBA Dharwad. On behalf of KLE BBA Dharwad, we are here to create awareness on ovarian cancer. So with us we have Dr. Santosh Chikkareddy sir. We all welcome you sir.
Thank you. Hello everyone, I am Dr. Santosh Chikkareddy, working as Senior Surgical Oncologist at CGNMR Cancer Center, Hubli. Today we have gathered here to create some awareness on ovarian cancer. May 8th is being celebrated as World Ovarian Cancer Day. So we thought of having some cancer awareness drive. So in that view, we want to discuss few aspects of ovarian cancer today.
Sir, firstly, on behalf of KLE BBA Dharwad, thank you so much for taking your time. So, as you said that on May 8th, World Ovarian Cancer Day is celebrated. So, can you please tell us what is ovarian cancer?
Yeah, ovarian cancer is one of the commonest cancers which occurs in females. So, in India, it is the third most common cancer occurring in females. So, we have an incidence rate of around 7 per lakh population of ovarian cancers at present in India. And it is going to increase in the next 1 or 2 decades. As all of you know that cancer is on the rise, and so in terms of females, breast, cervix and oral cancers are very common. So as a definition, ovarian cancer means a cancer arising from the ovaries, also called in layman terms as a bag of eggs for females. So this is one cancer arising either from the ovaries or the surrounding tissues, also called as the fallopian tubes.
So suppose sir, as you said, it is mostly occurred in females only. So how can a patient identify that she has a cancer?
So generally when we talk about ovarian cancer, we have to understand certain things. Firstly, what are the risk factors of cancers? So the ovarian cancer is divided into 2 aspects. One is the hereditary cancers that runs in families or the genetic related cancers. Other is the sporadic cancers. Sporadic means occurring due to environmental causes and not due to the genetic causes. So the main risk factors for ovarian cancers are certain things related to hormonal changes. That is basically, one is age. So basically, though there is no age which is immune for cancers, but we have 2 subsets of ovarian cancers, one in younger population, one in older population. So 2 different types of cancers occur in 2 different age groups. So one is the age, the second risk factor would be obesity, the third risk factor would be a late pregnancy or no pregnancy occurring in a female, and the use of hormone receptor hormonal therapy, that is what is called as hormone replacement therapy in a case of menopausal women. And certain other risk factors include not consuming OCPs. So any factor related to increased estrogen exposure to the female is a risk factor for occurrence of ovarian cancers. And coming to your question as to how do we know that she has ovarian cancer. So basically, when we talk about symptoms of ovarian cancer, so in the initial stages, the patient may not have any symptom. So though everybody considers pain as the early symptom, but classically, patient do not complain of any pain. So in the initial stages, it is very difficult, and most of the cases are detected incidentally for some scanning or some other things done for other causes. But as the stage of the disease advances, patient may have abdominal pain, an increase in PV bleeding, very diffuse pain, a weight loss, and if the cancer spreads to other organs, it may be, then she may have symptoms related to other organs also.
Sir, as you said that there is no, we don't identify it easily because there is no pain in the initial stage. So what if we identify it a little later, and what are the treatment with respect to it?
So when we talk about any cancer, initially when the patient comes with any symptom or it is incidentally detected for some other evaluation done for any other disease, so we go in a very stepwise manner as far as cancer diagnosis is concerned. What we generally do is initially do some sort of confirmation of the diagnosis. So this is, in other cancers, this is usually done by a biopsy or FNAC or some needle test, what we call. But in ovarian cancer, because of the risk of upstaging the disease, generally we go ahead with the imaging findings, and in very advanced stages we do get a biopsy done from the disease which is spread to other parts of the body. So in terms of imaging, generally we prefer either a CT scan of the abdomen and the pelvis, or in recent terms, decades, we have been using a PET scan as the modality of choice for diagnosis. Along with this, we do have some tumor markers, like CA125, and in younger population, certain tumor markers which can help us in diagnosing the disease. So once the patient is diagnosed, we then label the patient according to the stage of the disease. Usually we have 4 stages of ovarian cancer, stage 1 to stage 4. So stage 1 to 3 are stages where it is localized or spread to the surrounding structures only. But when it comes to stage 4, it means that it has spread to other organs of the body. So once we do this, depending on the stage, we go ahead with the treatment of the patient.
Okay, so now as you spoken about the treatment, so what are the survival rates once the patient?
So treatment options will include again, so generally any cancer will be treated in 3 aspects. So we have 3 different modalities of treatment. One is surgery, the second is chemotherapy, that is in layman terms giving certain injections which are cancer related, and third is use of radiation, that is X-rays to treat the cancer. But for ovarian cancer, generally we don't use radiation as the main treatment options, but we do a combination of surgery as well as chemotherapy in the treatment of any patient. So surgery forms the main core, that is the core modality of treatment for any ovarian cancers. So in stage 1 and stage 2, we use surgery as the first modality of treatment. In stage 3 and 4, we generally go ahead and do first chemotherapy, then downstage the disease, and then go ahead with surgery as the treatment of choice for the patient. And once treatment is done, so we do get a report based on which further any treatments or any further follow-up is usually done. So this is the gist of treatment for ovarian cancers. So as you asked, survival rates, so we all know that in India most of our patients come to us in a very late stage. So most of the patients which we receive are in stage 3. So in stage 1 and 2, the survival rates are better. So we can aim for a survival rate of around 90% in stage 1, around 75% in stage 2. But when it comes to stage 3 and stage 4, so it drops down to around 40 to 50%. So that being said, this is being spoken of a very common type of cancer which we call as serous carcinoma, which occurs in older females. But when it comes to younger population, that is, we generally detect them as germ cell tumors, which is very common in the population. This is one tumor which can be 100% cured. So it is a tumor which is 100% curable. So in younger population for germ cell tumors, we can say that it's a completely curable cancer. But in older population, it depends on the stage in which they present to us. So for early stages, it's around 90%. For later stages, it's around 40 to 50%.
So now that we know that ovarian cancer being dangerous to our life, which can take our life as well.
Yes.
So there will obviously be myths related to it. So can you please explain us what are the myths?
Yeah, so more than myths, we would like to first discuss on prevention aspects.
Yes.
So as I told, there is no one particular cause of cancer. So for ovarian disease, we always talk in terms of risk factors. I told certain risk factors earlier, like age, obesity, so increased exposure to raised estrogen progesterone levels in terms of late pregnancies and late non-using breastfeeding. So we have all seen that in recent years, females, because of higher education, work prospects, so they have been neglected regarding the sexual and contraceptive practices as well as breastfeeding factors. There is a lot of change in recent decades, which has led to more and more cancers occurring in females, whether it is breast or it is ovarian cancers. So prevention again comes in 2 terms, that is the primary prevention and secondary prevention. So primary prevention mainly deals with the prevention of these risk factors which I have told earlier, while secondary prevention means screening as well as early detection of cancer and treating them. So when we come to primary prevention, as said, there are certain lifestyle changes which have to be made. So one is decrease in obesity. So we have to advise, and all the females have to undergo certain physical exercises. So imbibe a good quality of life in terms of healthy lifestyles, in terms of daily exercises, decreased use of junk foods, so not allowing their weight to increase beyond a certain limit, which will be unhealthy, and taking a balanced diet, so more in fruits, vegetables, and decreased use of red meat and certain fat and processed foods. So, and in terms of breastfeeding practices, we should avoid so late pregnancies. So any pregnancy more than 35 years is associated with increased risk of ovarian cancers. So we should avoid that. So all the females should promote breastfeeding. So this will greatly decrease the risk of ovarian cancers. And having said that, one of the components of prevention is genetic cancers. So there is one commonly known syndrome known as the breast ovarian cancer syndrome. So there is a mutation which is called as the BRCA BRCA mutation. So when this is positive in any female, so there are two types, that is BRCA1 and BRCA2. And the first type, the females are at increased risk of occurrence of ovarian cancer to the tune of 30 to 50%. So in the second BRCA2 mutation, we have a risk of around 10%. So these genetic tests can be done, and if they are positive, then they can undergo certain preventive surgeries so that ovarian cancer can be completely prevented. So when coming to secondary prevention, that is as a part of screening. So as of now, worldwide there is no fixed screening method for detection of ovarian cancers. We don't really have any screening methods as compared to cervix and breast cancers. So ovary doesn't have, unfortunately, ovary doesn't have any screening methods as of now. So the main concept and the main effort should be in terms of primary prevention, that is prevention of aforesaid risk factors like prevention of hormonal imbalances, consuming of proper diet, so concentration of physical exercise, preventing obesity, as well as frequent and proper visit to an oncologist whenever other symptoms or other treatment has to be done. So the public should visit an oncologist and do regular scans and regular clinical examination. So this will again help to detect the cancer early. So once we detect the cancer early, it is known that it is completely curable. So early detection is also an important component of secondary prevention.
Yes. Yeah. As I previously said that, could you please explain us about the myths related?
So as such, instead of discussing the myths only about ovarian cancer, I would like to discuss myths in as a cancer overall.
Yes.
The first myth is that it is cancer is considered as a death sentence. So I should like to break this myth and tell that ovary is not a cancer sentence. Earlier it was taught that once cancer occurs, cancer means cancelled. So the life of the person is cancelled. So that is not the thing now. So we all know we should take cancer as not a social stigma or any unusual disease. We should just treat it as any other disease like diabetes or hypertension, where it is very common. So cancer is just a disease. So a proper diagnosis and treatment in early stage has a very high chance of cure in all forms of cancer. So cancer is a death sentence is a myth which we should all be aware of. The second myth is like cancer is a communicable disease. People always think that cancer spreads from one person to another. So it is a myth, it is wrong. So cancer doesn't spread from one person to other. So cancer is not a communicable disease. The third is people always think that cancer is hereditary, that is, it is related to genetic disease. So I would like to today affirm that only around 5 to 10% of all cancers are related to genetic causes. So majority of cancers are sporadic. So what does sporadic mean? So when we talk about hereditary cancers, so these are cancers where both the changes in both the genes are inherited by the families from our parents, either the mother or father. But in sporadic cancers, what happens is only one mutated gene is inherited and the other gene is mutated by some environmental stimulus, whether it is chemicals, hormones, infections. So this sort of sporadic disease is very common in cancers. So contrary to the myth that it is mainly due to familial spread, so we should all understand that so cancer is mainly a disease of due to environmental causes. So our diet, what we consume, so So our physical activity, our healthy lifestyles, and certain infections, these are the main causes of cancer. So these should be prevented. So nearly around 50 to 80% of cancers are related to these completely preventable risk factors like infections, changes in lifestyle, sexual practices, and changes in diet and obesity. This is the main awareness what we want to give. So contrary to the expectation or a myth that it is hereditary, so I want to say that it is only sporadic in nature and it is completely preventable. So and some of the other myths include that people always think that pain is an early sign of cancer, but on the contrary, pain is not an early sign of cancer. So pain is a sign of an advanced stage of cancer. So usually all the tumors or the lumps in the body which are cancerous don't have pain as an early symptom or a sign. So this is very important to remember. Majority of our patients which come, they always feel that it is painless. So they thought that it is not a cancer problem. So this is another myth saying that pain is an early sign. And any other myths if you would like to discuss, I'll be here to clear those.
Sir, actually, I had heard the news that the tablets to cure cancer, they're coming into the market. So is that the truth?
See, as in any field, any other medical field, even in cancer, a lot of research is going on. So as of now, whatever efforts are going on are in different forms of cancer. There is no effort going on as a universal treatment or prevention strategy of cancers. So it is in a particular organ or ovarian cancer, certain medications or treatments are being evaluated. But for example, in prevention also, for example, like cervix, we have found out a vaccine which is called as HPV vaccine can completely cure the cancer. But for ovarian cancer, as of now, we don't have any such thing as a completely curable treatment. But we do have newer treatment options like immunotherapy, targeted therapy, which are helping us in giving a good quality of life, good survival rate, better survival rate to patients. But as of now, we don't have one particular tablet or one particular treatment for all forms of cancer.
Yes. Sir, thank you so much. Here we come to the end of our podcast. So you have given us very, very insightful information regarding to ovarian cancer, which is, I feel it's very important for each and every citizen to know about it. So guys, here we come to the end of our podcast today. Thank you so much for your time, and a big thank you to sir as well. So at the end of the podcast, I would like to say that every individual must take safety measures and also must spread awareness regarding the ovarian cancer or cancer as general. So thank you so much. Take care. Bye-bye.
Thank you.
Thank you, sir. Thank you so much.